Immunity is one of the most important topics for any medical student, and the basics of all the investigations what we do or the diagnosis what we do is based on this. So let's have a quick overview on immunity today. So what all affects us? So basically can be bacteria, virus, protozoa, fungi or parasites. Now what is the basic purpose of all these things? These want to utilize the host nutrition. They might damage the host tissues, produce some toxic substances. Some of them, like viruses, can even cause some chromosomal and genetic damage, and the cell structure and behavior changes with infection. So the body has a particular defense mechanism against their invasion. So what is it? It can be genetic. That is, right from our birth, we are not prone to certain infections. Some of them, the immunity is activated so fast that they don't need a prior exposure to the pathogen, and this is not related to the previous vaccination or immunization which has been done. So immunity, you can tell it is a general immunity where it is a generalized resistance to many infections, or a specific immunity against one particular disease. So when we talk about innate immunity, there are different mechanisms of innate immunity. The first one is the anatomical barriers. That is our skin, which is the largest organ in the body, is one of the most beautiful barriers against infection. Along with it, there can be some mucosa and secretions which do not allow the infections to settle down in a particular part of the body. Same way, the body also produces some chemical like lysozymes, interferons, and complement factors. These will interact with the particular invading organism and try to kill it or curtail it from entering inside the body. Once this pathogen crosses this layer also, then you have the cellular factors like your phagocytes and the natural killer cells, which can act on particular cells and kill the organisms. Along with this, you have a response where any infection happens, any inflammation happens, there will be rise in temperature, there will be inflammation, and there will be production of acute phase proteins. All these factors together will limit the possibility of us developing infections. When you look at the different types of immunity, what we have, first we have a species immunity. Means we are not affected by many diseases which affect the plants. Like for example, tobacco mosaic virus is very important pathogen, plant pathogen. It does not affect us. Okay. Then secondly, you have the racial immunity. Owing to our race, we have certain privileges. Like certain populations do not develop malarial infection because of the slight difference in the shape of their RBCs. There can also be individual immunity, which is a baseline in a particular person. It is not to a particular genus or a particular race. It is to a particular individual alone. So when you look at the prevalence of infections or inversely the immunity factors, so you see that there are both the extremes, that is the early infancy and old age, are there is high rates of infections. Why? Because in infancy the immunity is still developing, the immune system is still immature, it has to learn a lot, so there will be a lot of infections. In the old age is due to waning immunity. So the peak comes in the adulthood where there also some infections are there and the body will try to fight off as much as possible. So what all factors can prevent this immunity being very active? One is conditions like diabetes, hypothyroidism, or adrenal dysfunction. What they do, they'll basically bring down the possibility of our immune system reacting normally. Pregnancy is a high steroid state where the patient is considered to be immunocompromised, physiologically immunocompromised. That steroid state is to maintain the fetus, but there is also a higher chance of developing infections. Regular use of corticosteroids for any other infections or inflammatory conditions can also decrease the immune response in the body. And most importantly, which is more relevant now, is the psychological and physical stress that can release steroid hormones, and it can bring down the overall immunity in a patient. So, what happens? The main thing is dependent on the nutritional component. If the patient is nourished well, the immune system also acts well. There are some infections which basically wait till the immunity comes back and they attack. For example, is the malaria. In history, you can see that during famines, you have not seen much of a malarial infection. The parasite is there, it is inside the body, it will wait for the nutritional status to improve and the new immune system to come back to normal, and then the infection is produced in this particular disease. So you look at the various anatomical barriers. So you have the skin, which I told you earlier, that is the largest organ in the body preventing infection. Plus, it has the ability to produce sweat, which is high salt concentration, which will kill most of the organisms. There's also some sebaceous secretions, which will basically not allow the lipid content, will not allow the pathogen to enter inside the body. Then the basic structure of the nose itself does not allow the pathogens to enter very freely. Once it enters inside, you have a mucus lining where these pathogens can get trapped. In the respiratory tract, you have some cilia which have a particular motion driving out the organisms and not allowing them to go inside. Plus, you have the reflexes, you have the swallow or cough reflex, which can basically throw out the organisms. Now we look at the other systems. You have the digestive system. So already we know that saliva contains lysozymes, stomach contains various acids. The pH varies from acidic pH to alkaline pH throughout your GIT. So that particular change also will not allow organisms to settle down. Conjunctiva or the eyes, you have this tears which also contains lysozyme, and the continuous flushing action. Every time you blink, the tears roll out and it will prevent the infections from entering inside. In the genitourinary system, you have the flushing action of urine plus antibacterial compounds like spermine and zinc, which will not allow this particular infections to get inside via the urinary tract. In the females, you have a acidic environment in the vagina, which is basically because of fermentation of the glycogen by the lactobacilli. So this acidic environment will also kill most of the bacteria. The basic concept is every part of our body contains normal flora, which will fight with the invading organisms for their space and nutrition and everything. So this will not allow any kind of organism to enter inside. There's also a protection of bacterial toxins locally, which will not affect the human body. If at all there is a particular disruption in this normal mechanism, then it can lead to opportunistic infections. So, whenever you grow something or you use too much of antibiotics, there's always a chance of infections developing because of the non availability of the normal flora. Chemically, once you enter inside, there are a lot of complex chemicals. It can be beta lysins, the leucins from the leukocytes, from something from platelets called plaquins, lactic acids, lactoperoxidase, and some of the interferons which are produced by the body are basically very good at killing bacteria, as well as interferons are very much active against viral replication. So, what are the cells which help us? You have the phagocytes. So we all know that these phagocytes are very good at finding out the abnormal cells, abnormal foreign pathogens, and basically trying to kill them. They will release some chemical inflammations. So, this chemical signals will attract more cells like the natural killer cells. These natural killer cells have a very good activity against the viruses and tumors, and these cells are activated by interferons produced locally. So whenever there is a chemotaxis, the phagocyte will release some chemical signals. So this more phagocytes are involved there. The bacterium will slowly get engulfed by the phagocyte, what is called as a phagosome. Then the fusion happens, and the lytic enzymes will act inside the phagocyte on the bacteria, what is called as a phagolysosome. And finally, the lethally, they will kill these pathogens. And what is more active is there is the reactive oxygen species. Some bacilli or some bacteria have also found, even viruses have found ways to escape this the phagocyte action and live inside the phagosome and multiply. Then we have the systemic inflammation, where there is a whenever there is a tissue injury, it will immediately lead to vasoconstriction followed by vasodilatation. So this vasodilatation will allow the WBC to come out of the blood vessels into the local area, produce a lot of chemical signals for more other phagocytes to reach there, what is a process called as diapedesis. And they will produce their products and finally form a fibrin layer, which will effectively cover that area, making sure that the infection does not spread from that particular area. Fever is a very good mechanism against infection. So whenever there is a body temperature rise, which happens because of the uh, immune response, so most of these pathogens cannot survive at a higher temperature. Historically, before antibiotics, the fever therapy is used for treatment of syphilis. Then, heat will also stimulate the production of interferons, which will allow for early recovery from viral infections. So once that is done, you have a lot of the acute phase proteins which come, which is the C-reactive protein, the mannose binding protein, alpha-1 acid glycoprotein, and serum amyloid P component. What they basically do, they will activate the complement system. They will basically enhance the host resistance, prevent injury because they are more specific to the cell which is infected, and they will also allow for repair of inflammatory lesions. So basically, to understand this concept of innate immunity, you can say first of all there is an anatomical layer, which is the skin and mucous membrane, which block any kind of entry into the human body. So next, if the organism bypass this, then you have the chemical layer, which is the lysozymes and complement system, which basically degrade the threat. Then you have specific cells, like cellular layer like your phagocytes, which basically interact with the pathogens and kill them. And finally, you have the systemic lesions where you have inflammation and some acute phase proteins, which will make sure that the organisms does not survive inside the human body. So innate immunity, basically, if you see, it's a concept where a lot of different layers are there to prevent us from infection. A pathogen which enters has to bypass all these layers to cause infection in the human body. This is basically a outlook of the basics of innate immunity. I hope I made it simple and crisp. Uh, Make sure to like and share this video and subscribe to my channel. Thank you.